Well, at-home chefs and professional ones taking no chances when it comes to Cyclospora.
Yeah, you got to be careful right now. The parasite going around causing all kinds of problems, including, yes, bathroom issues, right? We'll just leave it there. Luke Hydash covers New London County. We all get it, Luke. It's not a pretty sight if you get this.
Well said, Mark. Right now, there are more than 30 confirmed cases here in Connecticut. Cases are rising, and so is the demand for testing.
Especially the summertime, we are busy.
It's busy season at Jack's Brick Oven Pizzeria. Despite the name, salads are one of the most popular things on the menu.
All fresh. And we cut them here, wash them, and store them in the coolers.
Owner Jack Chinbali isn't taking any chances. All his produce is bought fresh and washed well, with Cyclospora cases rising.
We've seen a significant increase in testing volume for Cyclospora.
Dr. Ann McIntyre is an infectious disease expert with Quest Diagnostics, which uses stool samples to test for the parasite. Results take up to several days to come back.
Many individuals who are otherwise healthy will actually do well with the disease. It'll run its course. But some individuals, say at the extremes of age, for example, or those without a healthy immune system, can have a more challenging course of illness.
The state health department recommends avoiding pre-bagged produce or lettuce, washing leafy greens and produce well, and cooking these items to reduce risk.
The vast majority of them will have this lingering diarrhea and lingering symptoms that sometimes can continue for days and weeks.
Dr. Aryat Gega is an infectious disease expert with St. Mary's. He says it can be days between when you ingest the parasite to when you show symptoms. If you suspect you have this, ask your doctor to be tested specifically for Cyclospora. Right now, health experts are working more to figure out about the cause of this outbreak nationwide. Your reporter live in Norwich, Luke Hydash, Channel 3 Eyewitness News.
All right, Luke, thank you.